One of the questions I get asked often around summertime is things about kids. When do you bring them in first for their first dental appointment? And how do I make sure that their dental experience starts out great? So whether that is because you're around your kids a lot or because you're just thinking ahead to school and the different things that you need to check off the list to get them ready, I thought that I would let you know a few of my tips about kids and the readiness for the dental chair. So first and foremost is that we love to start kids out on a positive path as soon as we can. Of course, the maturity level of an 18-month-old, 2-year-old is going to be different than a 6-year-old, but if your child is mature enough and can sit in a chair and open their mouth and follow directions, we love to see them, at least to just explore and to show them the instruments and to get them familiar with sitting in the chair and experiencing that. Each time that they come back, they're going to establish a relationship with our hygienists, their doctors, and assistants, and just become much more comfortable each time. So we'll be able to grow that relationship as we go. The second thing is realize this. Your perceptions and attitudes as a parent and a family member definitely color your child's attitudes about the dentist as well. And be so very careful because your negative or positive perceptions definitely affect them. So if you've had a struggle with a dental experience in the past that you're still kind of fighting against, make sure that you're very, very careful about introducing fear or anxiety into your child's life. If you've had positive experiences, by all means, talk a lot about it and get them excited because it should be a good experience, especially those first couple of times. We want to make it a very happy experience and something that feels good too. Third, kind of a practical tip, if you want to avoid a lot of strife in your child's life, avoid sugary beverages like pop and candy as much as possible. We know you can't completely eliminate it, but make it something for a special treat, something that's a once in a while kind of thing instead of a daily occurrence. The best way to do that is not to have it in your home. I mean, take a trip out to the ice cream shop or to Quick Shop to get some candy, or have the pop be something that you do when you maybe go out and get your car washed or something, or like a weekly occurrence, but not something you do every day with your child. And they will start to associate that with something special, but not something that's daily, that they expect, that they have as their diet. And I think this has saved me and my own kids. I don't have that stuff at home. And granted, it's because we are a 2-dentist household, but it's a big, huge saver of teeth. Sugar does cause cavities, and it makes it a little bit easier to prevent them when you don't have that readily accessible. The last tip too is if your child comes in and say that they do have a couple cavities, rather than talking about that a lot, about what that means and what's going to happen and what the dentist is going to do, just talk in broad strokes, because we will talk and prepare your child. We just don't want them to be overwhelmed with all the details because there's a lot of stuff that will go on, and sometimes again you will color that interaction with them and maybe even introduce some fears. So talk about it in just broad strokes about how it's going to be a great time and a great experience to get rid of the cavities or whatever it may happen to be in child appropriate language, and then just leave the rest to us because we would love to take care of your child, and we'll do that to the very best of our ability. I hope this has helped. Kids are some of our favorite patients, and especially when we can start them young and grow them into really confident, happy, positive patients with good experiences, it makes everything work so well. So this is Dr. Kate. I hope that you've enjoyed this today. Thank you.